Welcome to Respiratory HQ's Journey to Success podcast, the podcast specifically for RT students, because you all are the future of the respiratory therapy profession, and not everything you need for success can be found in your textbooks. I'm Tanya Peel. I'm so excited to be here to give you a little guidance and insight, a few tips, maybe a few tricks to help you be successful on your journey through respiratory therapy school. Let's get started. Hello, everyone. Welcome. So glad you could join us today. And I'm thrilled to have a very special guest with us. Her name is Budur Khudaybergenova. She is an RT student in the United Arab Emirates. Hi, Budur.
Hi, Tonya, and hi, everyone. Thank you so much for introducing me. And I'm a third-year respiratory therapy student in United Arab Emirates in Khawarizimi International College, which is the first and only university in the United Arab Emirates that offers a Bachelor of Science in Respiratory Care program. Originally, I'm from Uzbekistan. I moved to UAE back to 2019, and I took a gap of 1 year to improve my English and take an IELTS course to get into my RT program in my college. And I enrolled in my program back to 2020. And since then, I've been into my program.
Good deal. So English is not your native language. What is your native language?
Actually, my native language is Russian. And as well I speak Uzbek, I speak Arabic and English.
4 languages, so you are multilingual, which is a great skill to put on your resume. Those of you that if you just speak even one other language, make sure you always include that on the resume, guys, because it is so valuable. Okay, so you and I we Zoomed last week and kind of got to know each other a little bit, have been texting back and forth. And so what I want to do with this podcast is show everybody that's listening, no matter where we are in the country, it sounds like you're so far away and we must not have anything in common, but I want to kind of talk about your experiences in RT school. And when you and I met last week online, you introduced me to a study that was done in Saudi Arabia. And so this study is entitled Burnout and Resilience Among Respiratory Therapy Students in Clinical Training in Saudi Arabia. And guys, I'm going to provide a link to this in the podcast description. But basically, this study took 559 RT students across 15 different RT programs. And basically the students answered questionnaires, and these questionnaires were designed to assess their level of burnout and their level of resiliency. So of the 559 students, 78% suffered a high rate of burnout. Now, this burnout was classified in 3 different segments. So basically, burnout as it related to emotional exhaustion, burnout as it manifested in depersonalization, and burnout manifesting in low personal achievement. And what was really interesting also about this study, because I don't think the fact that people feel burned out, I don't think that is as mind-blowing as the fact that students that had higher level GPAs actually even suffered a higher level of burnout. And this burnout increased the longer a student was in school. So, and then tagged on to that, it assessed resiliency, and only 2% of the 559 students reported a high level of resiliency. So we have a very high level of burnout, but a very low level of resiliency. So obviously when you read this, you thought about this and how you were experiencing some of the same things. So can you tell us about your experience with burnout in both classroom clinicals, or the stresses that relate to that burnout?
Yes, I absolutely agree with the research paper, because, as we start the RT program, which is from my perspective, is quite challenging journey, and we start facing lots of responsibilities, such as meeting our deadlines, being prepared for our exams, as well as being focused and alert during our classes to avoid further misunderstanding as, we progress further and advance with the certain topics related to our major. And those responsibilities, they can easily lead any RT student to experience burnout, especially when we advance to the level where we start our clinical rotations, where everything we've learned now we have to apply on the patient's bedside. And healthcare environments are the most stressful occupational settings, right? And those environments, they can easily put RT students at the risk of the burnout. And I'm very much agree with, actually promoting and building the resilience among the RT students to actually bounce back and, to build that shield against the stress and how, that stress could affect our performance, mental and physical well-being. So I find it very important to build the resilience, and I have my tips on it, and I would like to share it further in this podcast.
Okay, yeah, I think that is great. So really, guys, the purpose of this podcast is to work on tips and strategies to build resilience. And so the majority of the information, not only the study, the majority of the information we're going to talk about really comes from a couple of different resources. It comes from the American Psychological Association and the University of California, Berkeley. So I am going to, in the podcast description, put a lot of links if you want to research this further. But I think we're going to first start to make sure we all understand the definition of resilience. So resilience really is the process of us adapting to adversity, to trauma, to tragedy, to threats, or any really significant source of stress. RT school, family and relationship problems, financial problems, and sometimes these stressors come at you all at once. And so resilience is the ability to bounce back from those difficult experiences. And would you say, Budur, in doing this, do you think there's personal growth in it?
Actually, there is no universal formula for building the resilience, right? It's quite personal. What might work for me might not work for others, and it's each and everyone's journey to find out which tips and what actually can help, to build the resilience, to accommodate to the stressful environments and everything that comes with it.
Absolutely. So let's make sure that everybody understands too. We're going to talk about tips and strategies, but being resilient does not mean that a person will not, they're still going to experience difficulty. There's still going to be emotional struggles. There are still going to be stressors in life. And so we by no way are minimizing that personal experience. What we're doing is building up that resistance to the stressors. The resiliency is that ability to come back in a healthy manner from any type of adversity. So everybody, what we're going to do is talk about 6 ways to build resilience. And the first way we're going to explore is how to mitigate stress as much as you possibly can, because we all have certain situations that are stressful, but sometimes we add stress upon ourselves and we can minimize it. And one of the primary ways to minimize stress is to use organization and time management skills. So Budur, tell us about your organization and time management in class as well as clinical.
I see that time management is one of the most important skills, because back to when I just started my major, I didn't have a clue about the time management. I would procrastinate. I would not be able to finish my work due to the deadline. So all of those things, I just reflected on them and I understood that I need to stick to the time management. I have to plan my, the assignments. I have to write them down. I have to manage when and where I have to study, because keeping up the work until the last moment isn't healthy for all of us, right? As a student who just starts the major, not all of us are actually aware of that. But as the pressure accumulates, you just understand that this is the most essential thing when it comes to time management, because that's when you reduce the pressure that is applied to you, because you just break down the things that you have to do, and you do them slowly but throughout some period of time, rather than they just accumulate on the last day of your due date, and you're just like so stressed and so worried, oh, how am I going to finish, and that time management is really a high skill that all of us have to, improve.
Okay. So it sounds like you do, you probably have a master calendar or something with all your tests and all the deadlines and everything. And one of the things from an instructor standpoint, you've really touched on it, is you have to do it a little bit at a time. You cannot wait till the very end or right up next to the deadline, especially with studying, because if you're studying right at the very last moment, it's only going in short-term memory, but all the information you're learning has to accumulate over time so you can learn to work with it. So I think your idea of planning your day is perfect. Tell me a little bit about how clinical might be different.
A clinical, for example, for me, we start our clinical from 8 a.m. sharp. So I have to wake up around 6 a.m. And I want to emphasize so much on, having a breakfast, because when you are at the clinical side, you run after your RT, and believe me, RTs are so fast. They're just like run from one unit to another. So you gotta have all that power to run after your RT, perform tasks, understand and learn, observe and everything. So when it comes to clinical time management, I would suggest that you prepare your meal night ahead of your a morning duty, or if it's your night duty, so you prepare it just a night day before, right? So it's very important to eat well, and it is very important that you are on time on your clinical rotations, because it just shows how prepared you are, because people are actually observing you when you are at the hospital. That also could affect either you get employed or not, because people would have an idea about you. They will say, oh, that student is always on time, she's very punctual, or oh, I wouldn't suggest that student, he's never on time, and that plays a huge role. And I think it's very, very important to actually get enough sleep as well, because you cannot learn or perform when you are not got enough sleep, because the sleep is so essential, at least 7 to 8 hours. And that's what really helps me to to be on time and everything.
Yeah. So you are on the other side of the world from us, but everything you just described is exactly how every RT student feels no matter where. And it's probably something every RT instructor coaches the students to be cognizant of. Okay. So there is still always going to be stress, right? No matter how well organized you are and how well you manage your time, life has stressors. And so we have to be able to have healthy outlets for that stress. So how do you manage the stress that you do have in your life?
I have few strategies to deal with the stress, and I find them quite healthy, the healthy way to deal with my stress. And one of them is I emphasize so much on the physical activity and the physical health, because sometimes when you sit for like more than 2 hours, you are studying for more 2 hours and your body is sore and you are feeling tired. Just a simple walk could give you so much energy and recharge you, that you could go back to your studies, more energetic, more motivated. And the physical activity brings up so much, especially when it comes to a mental health, because it clears your mind. It helps you with even better focusing during classes.
Yeah.
I better focus if I exercise. I feel that I'm in a healthy body, and right now I want to do better, and I want to study, and I'm feeling amazing because I exercised. And another thing is, what helps me is the self-care. And when it comes to self-care, I don't only mean like like skincare, nails, and everything that we girls like, but as well as a self-care when it comes to your soul. Just recharging yourself by maybe reading your favorite book or watching your favorite show. For example, when I lack the motivation to study, I could just turn on some medical show and watch it, and then I get so motivated, and I was like, I want to go back to study. I want to be like them. I know that it couldn't be like the movies aren't, sometimes they're too exaggerating, they're a little bit different when it comes to real life, clinical sites. But it really helps me. It's where I get my inspiration from. And another thing when it comes to self-care is just positive self-talk, because whatever you say to yourself affects you. It affects your performance because you are the only person who has to believe in yourself. Because if you don't believe in yourself, no one will, and that positive self-talk, even for example, if you didn't do well on your exam, but you just reflect on it and you just understand your mistakes and you're just like, that's fine, I'll do better next time. I'll learn. I'm still here to learn, right? I still have time. I will improve. It's better than, biting yourself for your mistakes. So positive self-talk is very important. And another way I deal with the stress is social connections, because socializing is so important when it comes to getting out those emotions that you had. For example, with you performed bad on your exam, or you saw something at your clinical site that made you really sad, and just talking with someone helps you to relieve actually those thoughts, to relieve the tension from your body and from your mind. Just you can call your friend, you can talk to your family member, just talk. By talking, it just helps you so much to actually get back to the state you were before.
Yeah, before you ended up, before you got as stressed or worked up for whatever triggered you.
Yes.
Absolutely. I think those are great strategies. As a matter of fact, I think I've done a few podcasts that talks about the benefits of exercise and eating right and self-care. I love the reading. I do that. I try to do that every day. It's one of the things that keeps me sane. So yeah, great ideas. Okay. The second way to deal or to be able to build resilience is facing your fears. So when you start RT school, there's a lot of stress of the unknown, right? The first test is stressful. The first of everything is very, very
Yes.
hard. And so by continuing to show up and face that which you are a little afraid of, tell us what that does for you.
Facing my fears, actually, I had an experience when I just started my clinical rotation. I really was scared to do inline sectioning of a patient because of their gag reflex, and they were the way they were, having that reflex. They would move their bodies, they would move their hands, even if they are like sedated, they would have that gag reflex. And I was really, really afraid. I thought I'm causing them pain, but they are actually having all those infusions going into them, the painkillers, the sedatives. So it's just the gag reflex, right? So I understood that I can't just stop doing that because it's a part of my major, right? It's a part of RT. What is it called?
It's a part of our scope of practice. It's exactly what we're supposed to. So as you do it more often, how did you feel?
I just started to exposing myself more to it. I would ask my RT that would be with me. I would ask her, can I sanction that patient? So I would face my fear. I would expose myself more and more, that I would actually acquire and would be less scared of doing that, because there is nothing to be afraid of when you've done it multiple times and you see that that's not actually scary, that's just in my head.
Yeah, absolutely. I tell my students all the time, the very first competency that they perform in front of an instructor is the hardest competency. They've never done it before. It's never been that high risk situation. They're nervous and not, while they may continue to be nervous with each competency, there will not be a competency that is as bad as that first one because they're continually facing their fear. So you've got to get through it, and that repeated exposure will minimize that fear of certain things. All right, the third way to build resilience that we want to talk about, we're going to entitle it Change the Narrative. You know how in life when something bad happens, whether you fail a test or have a bad day in clinical, or you have an experience with another person that you don't agree with each other, we have a tendency as humans to want to focus on the negative and go over and over and over that situation. So when we say change the narrative, what that really means is finding a way to empty your head, your mind of that negativity and replace it with something positive. So Budur, I think we talked about journaling a little bit. Do you journal?
Yes, we did. I do journal. It literally helps me to clear up my head. It helps me, for example, previously we talked about the social connections, but sometimes people get so busy that they just simply don't have time for us, right? And we have an alternative to that, which is the journaling, where you actually can express your emotions. And once you express your emotion, you understand that those thoughts, they aren't as scary as you thought they are, or they aren't as dark as you thought they are, because you just write them down and you see there is nothing to be afraid of. You just express everything you felt, and that's absolutely all right to feel that way. And you just get out of your head everything that you felt, every emotion. And I think that's a very healthy way of dealing with your sadness, like depression and just a bad day. You just write it down and it's like it's gone, it's on a piece of paper.
Yep. I have actually read, and I've actually practiced this also, just setting a timer. And it's not really journaling, it's just getting all of those thoughts out, setting a timer for 5 minutes and writing anything about a situation that comes to my mind. It doesn't matter how bad it is, how ugly it is, how angry I am, how sad I am. I get all of those emotions down on that piece of paper. It's out of my body. And then the strategy is to burn it, because when you burn it, it is, it's gone. It's just that example of getting rid of it. So now once you journal or you get rid of that, you have to start looking for the positive. And there's actually it's called the silver lining effect, or the silver lining strategy. It's about taking a situation, and maybe it may take a day or two after that situation, but reflecting back on it and finding what came out of it that was positive. Can you give us an example of how you've used a silver lining strategy?
I actually experienced that. For example, I remember on my second week of my clinical rotation, when I just started, me and my classmates came to the RT department, and one of the RTs say that we have to go out and do the walk of honor. That was my first time experiencing that, and there was a little girl that passed away. She was around 8 months old. So we had the walk of honor. You see the sobbing and crying parents. You see other healthcare workers who are also, crying. And we just walk there. And that was my first time feeling lost. That was my first time seeing, parents crying in front of the child's bed, and they're so helpless. They can't do anything, right? And once we stopped, when they switched off her life support, that was the hardest part for me and for my classmates. We just started sobbing. We just started crying, all of other nurses and healthcare workers when they were taking her to OT. And but after that, I would just say to myself, but Budur, this is the thing that is not under our control. This is something that happened. And that little girl, she was under so much care, love at her last days of life, right? And her death could give life to someone else. So I looked at that on the brighter side of that situation by thinking that, that girl she was taking care of, she passed away without the, being in a pain or being alone. She was surrounded by her lovely parents. All the healthcare workers took a really good care of her, and her giving her, parts of her body to someone else can save maybe more than 2 or 3 lives, right? That is also one of the, positive parts of that situation that I try to look at, to sort of shift my focus from all the sadness and, the situation that was really sad, but I tried my best to look at the positive side of it.
Absolutely. That is one of the best things that you can do, is reflect back on and try to find the positive situations. The next strategy we're going to talk about is meditation. And so this is going to take different forms in different people. This can be breathing exercises. This can be practicing mindfulness. It can be talking about grounding strategies. So, Budur, do you have some experience with meditation?
When it comes to meditation, I think as as one of the techniques to actually get rid of the tension in your body and to ground yourself, it is a very helpful tool, especially when it comes to anxiety. Whenever you feel anxious, just simple like breathing exercises that we do during meditation, or like mindfulness, that you are, at the present moment, you are here right now, whatever is happening, like happening in your, best self, it happening for you. And as we are artists, right? And we know the importance of the breath. So it is so important to just ground yourself and breathe and understand that this is, it all shall pass, whatever is happening. I'm here right now, and whatever is.
Yeah, whatever happens, happens. So a lot of times with those breathing exercises, what we can do is sit still. And when you inhale, what they say to focus on is to feel that breath as it moves through your airway. And we know exactly what that means, right? Because we understand that
Yes.
anatomy. So to feel that physical sensation, the coolness as you breathe in, the chest expanding. And so focusing on that gets your mind away from what's causing you some anxiety, if just for a brief period of time, but it gives yourself the ability to reset. Absolutely.
Exactly. Exactly. Especially, you could practice the grounding strategies as well, because sometimes it happens that your thoughts overtake your reality, that you are so busy with everything that is going on in your head that you cannot stay focused. And those like grounding strategies, such as, paying attention whatever around you, counting your steps, looking at the colors, for example, touching something, focusing on the sounds around you. That would really ground you at the to the present moment and help you to actually focus on now. Because sometimes when you are um again, I would give an example regarding the exams, when you were so anxious regarding how difficult your exam was, and you keep thinking about the answers and what you did wrong and everything, and you just ground yourself with, you know, what is around me right now. And I'm
Mhm.
really grateful, and that I actually could take that exam, that I did my best.
Yep. I use grounding exercises with sound. When I'm very stimulated and anxious, I make myself be still and I try to find two sounds that I can hear from outside, and then two sounds that I can hear in the room that I'm in, and then finally two sounds that I can hear within my body. And I always, that last sound is me, myself breathing. And by the time you bring from the outside, inside, then internally, and you've been focusing on that, you have reset yourself from that anxiety. Yeah, absolutely, absolutely is a good method. All right. The fourth, we've already touched on this, practicing self-compassion. And you talked about that earlier, how as people, we are very harsh with ourselves. I have had students throughout the years, they do poorly on an exam or competency, and the first thing they do is berate themselves. Oh, I was so stupid. I knew better to do that. But you mentioned this too, and I love it. If it's the strategy is called how you would treat a friend. So if you had a friend in school, Budur, that came up to you and said, I failed my exam, would you ever say to that person, you're so stupid? Or would
No,
we wouldn't be that unkind to people, would we?
I believe we all have to be kind to one another and ourselves. I remember back to my second year, I think, when we had the patient assessment practical exam, and one of the girls, she was really like disappointed, and she was really sad after her exam, and she would come to me crying, I did so bad, I might, drop out and everything. And I would just like, no, stop, you've gone through so much, you know it is fine. You did mistakes, it's absolutely fine. Nothing has to be perfect. You did mistakes, you reflected on them, you learned about them. You did 1 to 2 mistakes, that's absolutely all right. You are still a student. It's better to make a mistake now than later on after graduation at the patient bedside, where it actually affects the patient. I would just try to calm her down. I would like emphasize on her, you know, um parts of her personalities that are actually really good. I would try to cheer her up. I will say like, but you're so good at this and that.
Mhm.
You shouldn't give up. One mistake is not, the reason to drop out the major. You've gone through so much, not to just, stop because of some small mistake. You can do better, and you will do better.
Absolutely. And the way you spoke to your friend is exactly the way you should speak to yourself when you hit challenges, or maybe you don't meet the goal that you have set for yourself rather than berating ourselves. Guys, we have got to speak positively and kindly to ourselves. Every once in a while, and I've mentioned this before, I'm just going to mention it again, a little bit of personal thing. My sister passed away a year ago, and this week has been kind of a rough week. And at one point in time, I just had to stop and say, you know, what I'm feeling is grief, and it's okay to be sad, you know, and
Absolutely.
just that positive talk, not talk like you should be over it by now. It's a year, you can't do anything. No, it's not, and it's okay. So when you are doing poorly on an exam, here's what I want you to tell yourself next time. It's one exam out
Mm-hmm.
of your whole entire curriculum. It's one exam. We need to figure out where the mistakes are. We'll fix the mistakes and we'll move forward. And you're right. I loved how you say that you're students, and it's best to make these mistakes as students so that you can have time to correct it before you hit clinical practice. Absolutely. That was just brilliantly stated. I love it. So the very last thing as far as building resiliency is knowing when to seek help. We can talk positively to ourselves, and we can talk to our peers, and we can talk to our family members. But there may come a point in time that we need somebody that is actually trained in helping us deal with trauma and anxiety. And it's very important to be able to reach out, understand you need to reach out and how to do so. And licensed professional counselors are not just about talk. Part of their training has to do with other methodologies like EMDR or brain spotting. It's not just going in and talking to somebody, although talk therapy is very beneficial, but there are other things that they can do to help us in times of our stress and anxiety and help us deal and recover from trauma. So it's really, really important to seek help. All right, so I'm going to do a recap of everything we just talked about as far as the 6 strategies to build resilience before we sign off. So number 1, here are the 6 methods to build resilience. Number 1, mitigate stress as much as possible through organization and time management. Number 2, face your fears. The more you do something, the easier it will become. Number 3, change the narrative. Get all of the negative out and reflect on what's positive about the experience. The next one, meditate, breathing exercises, mindfulness, grounding strategies. Give yourself a method in which you can come back down from those high levels of anxiety. Number 5, practice self-compassion. Speak gently to yourself. Give yourself a little grace when it's needed. And the 6th way is to seek help. Budur, thank you so much for joining me today and for teaching us that while we may be different as far as geographical locations, you're halfway around the world from me. Our cultures are different. Our language may be different. Our faiths may be different. Life responsibilities. We have so many differences, but we are all connected by the ups and downs of everyday life. Our human struggles know absolutely no boundaries. And hopefully, all of you that are listening have some sense of comfort knowing you're not alone in your struggles through RT school. So, no matter if you're in the United States or the UAE or China or Canada, no matter where you're studying, every respiratory therapy student feels the same way. And we study the same way, and we have the same stressors, just as Budur has talked to us. The funny thing is, you could come to class with me tomorrow and sit right in my class and fit right in with everybody because you're an RT student.
I would just fit in it, right?
Yeah, you would just fit in. Do you have any final words of wisdom for us or anything
I
you
would,
want to say to the students?
yes, sure. Thank you so much, Tonya, for this beautiful podcast. And I would really want to wish the, RT students who are just starting the major to believe in themselves that they can achieve anything that they set their mind on. And if you face a failure, it doesn't mean that you have to give up. No, you have to push, you have to do better, you have to reflect on your mistakes, and you can be better because you will be going through so much difficulties in RT program and so much responsibilities, but at the end you will be just so grateful that you never given up and that you believed in yourself, because I believe in all of you, and I wish you all the best with your upcoming semester, and thank you so much.
Oh, thank you. That was so sweet. Thank you for being here today. We're signing off now, everybody. So study hard, do good, and I'll see you soon. Bye bye.